Number 5 on the list of 25 things you can do to lower your risk of Parkinson's, according to the Parkinson's plan, is to avoid or at least manage diabetes. Okay, easier said than done, right? So there's a lot that we can do in this category as well. And what I would like to share with you in this short video are some of the things that maybe are outside of what people normally think about when it comes to managing or avoiding diabetes. Again, this is from the Parkinson's Plan. This is a great book by Dr. Ray Dorsey and Dr. Michael O'Kuhn, and they have put together 25 different actionable items that you can do to lower your risk of Parkinson's. So I'm sharing them with you one at a time. Now, on my website, the Strong and Health website, when you go there, there's a little button up at the top that says free guide downloads. And one of those guide downloads is about metabolic health. In fact, it's healthy blood sugar habits. So this is one easy way I can give you some resources for free that will help you incorporate valuable habits and nutrients into your life to help improve metabolic function. That's one thing that you can do that would be maybe outside of what you're already thinking about. Now, whenever I have a conversation with people about blood sugar and they're thinking about medication, I do also want to remind them that there are sometimes herbs that can be worth investigating. And usually I would encourage you to do a Google search of berberine versus metformin, or berberine and blood sugar. And you're going to find some great resources out there. This is from the National Institutes of Health Library of Medicine. So this is a really encouraging look into an herb called berberine. And if you haven't looked into it yet, please do and figure out if that is going to be something that you may want to consider. Now, another herb that I think everybody should be aware of if they're struggling with or having challenges with blood sugar is gymnema. I don't know how many of you have ever heard of this, but it can be also known as the sugar destroyer. This is a wonderful herb, and there are some amazing long-term studies on this, actually after 18 months of use. Not that you have to take it for 18 months to get any benefit, but I really strongly encourage anybody who's struggling with these to know about these two herbs, look into them. And if you're going to think about layering them into your life, of course, talk to your healthcare professional, but make sure you're getting them, most importantly, from a very good source. Of course, one of my favorite sources are from Integria out of Australia, also known as MediHerb in the United States. And speaking of, there is an very interesting article I found from the company Standard Process, who imports these herbs, talking about support for healthy GLP-1 function. Why is that interesting? Well, obviously, a lot of people are taking a medication to specifically help with GLP-1. So I think it's very important that everybody know that there are healthy ways to support natural GLP-1 function. Now, this isn't an exhaustive list, but I would definitely look at these resources. And if anybody wants more information on this, you can. There are things out there like whole food fiber, an herbal combination called Digest Forte, fish oil, and something called Glucose Assist that they put together. And they have a very interesting rationale on the importance of that. And one last thing, one sneaky little thing that a lot of people really don't think about when they're struggling with blood sugar is kind of out there. But I do want to share with you the research on this because I find this one particularly helpful to know about. Sometimes there may be a small infection in the pancreas specifically that could be affecting your body's ability to regulate your blood sugar. So maybe it would be worth your while to look into whether or not you may have some bugs that could be part of the problem. I'm not saying it is, but when we have so many challenges with blood sugar and we're trying to avoid or manage diabetes, sometimes we need to dig deeper beyond just cutting out sugars, beyond just going towards a low carb diet and getting more exercise, all very important things. And you're going to hear that advice from a lot of different people, of course, to have a diet lower in refined sugars and carbohydrates and higher in exercise, not a diet higher in exercise, but getting more exercise. But sometimes people hit these stalemates, and that's why we need to have different perspectives and unique things that we can offer. And these things I find are some of those that most people aren't thinking about or they're not incorporating. And I want to make sure you have all your options so that you do not give up and you continue to be able to get to where you need to be. So avoiding or at least managing diabetes can be a huge piece in helping prevent with this Parkinson's. And again, I encourage you all to check out that book. We'll have more of these videos to come as we get through all 25 plus my 26th action step that I would encourage people to take. Have a good day.